My name is Rohingya, and I am a senior program officer working with the Directorate of Health Promotion, Ministry of Health, also the Social Safeguard and Environment focal person for the SWEDD project. I know we've heard about the SWEDD project. Some of us are quite familiar with it, but as we do this opening ceremony, we will just tell you briefly what SWEDD is, and immediately the presentation on the background of SWEDD itself will follow. But before I go ahead, I would like to recognize the presence of Mr. Omar Mbake, who is the operation officer for the SWEDD project. And here he is wearing two caps. He is sitting here deputizing the project coordinator of the project coordination unit, that is the PCU, which is the unit that is hosting and coordinating the funds of the SWEDD project. He also double as the PIC chairperson, deputizing the PIC, and the PIC is the project implementation committee from the Ministry of Health. So Mbake is wearing all these two cards. So our task this morning, I will just be doing the welcoming remark, and he will do the opening. Yes, so before I go into the opening proper, I would also like to really thank all of you for responding to our call. We are always grateful for that. Anytime we call since the beginning of the year, when we started the implementation of this project, every time it has been quite successful, and we have seen a manifestation of that. I would like to recognize all of you. In our midst, we have government partners, we have CSOs and NGOs, all ably represented here. And I know immediately we do the opening ceremony, we will introduce ourselves so that we can know each other. So briefly, just to tell you once again, SWEDD is Sub-Saharan Women Empowerment Demographic Dividend Project. And SWEDD is a multi-sectoral government project. It's also a sub-regional project. But we are always excited to say that the SWEDD has been in Africa for over a decade. But the Gambia joined the SWEDD project early this year. And fortunately for us, we are the first Anglophone to become part of the SWEDD project. And I think we have done incredibly well. And this couldn't have been done without you, the very people sitting with us here. And just last month, there was a SWEDD team who came for filming that work, of course, in collaboration with Njai. They came to see what we've done so far. So that means our reports are quite uploadable at the regional and at the global level. So why we call for this meeting today is to do stakeholder engagement, because we've been working together with most of you, collaborating directly and indirectly. So we will present to you what we have done so far, and also where we are, the challenges, and how do we move forward. So the additional stakeholders that we are going to work with, how can you also come in play, and how we will collaborate moving forward into the 2025. Because SWEDD has not come to create anything new, but also strengthen the systems and what is already on the ground as far as the objective of SWEDD is concerned, which is to improve adolescent learning, economic empowerment, and access to maternal and to productive health.
Thank you very much for coming to this 2 days activity. We are all aware that the SWEDD project has been working with you people and other stakeholders across the country for almost 2 years now, but effectively the proper implementation started this year, or I would say late last year, sometimes around October 2023. As the ENS focal person have rightly mentioned, this is an important activity that actually they have tasked themselves to do with you people at the end of the year. It's a stakeholder engagement, and one will ask, what do you mean by this stakeholder engagement? Stakeholder engagement can be in the middle of an activity, it can be before an activity, it can be at the end of an activity, but this particular stakeholder engagement is at the end of the year's activities around the ENS aspects of the project. Environment and social safeguard, these are very important components in any World Bank interventions. I would say without this particular component, don't expect to have a World Bank project. World Bank projects, before effectively you get them, they have to look into the environment and social safeguard aspects. These are issues that actually probably might one way or the other bring in negative consequences in the society once the project has come into effect. It could be environmental, it could be social. Because the intention is not to come and create more problems for people. The intention is to come and ameliorate, improve the lives and livelihoods of individuals at the end of the 5-year implementation. So their intention is not to come and create more problems for the society. So the first thing they'll have to do is to do an E&S study to find out if there are any issues that come along during the project implementation that will have an effect on the lives of the people socially or environmentally. I thank God for the SWEDD project. We wouldn't expect much of that to happen environmentally because we are not going into constructions. I'm sure all of you are aware of that. Happy to have you here. This shows a commitment from your people that you are part and parcel of this project, the appreciation that you have shown, the commitment that you have shown towards the project development objective of the SWEDD project. The E&S is something that actually has to be looked into critically. This is why we have Rohi as the focal person. By the way, she's also working with another expert of ours. She is the second lady. Rohi is the second lady, and the GBB focal person is the first lady. She's also looking at the gender-based violence aspects of the project. I mean, these are issues that actually we know we cannot do without them. We have to look at them actually as we go along the implementation of this project. So now, this is just the opening. It's good that we know that SWEDD is a sub-Saharan, regional project called Sub-Saharan Women Empowerment Demographic Dividend Project, like Rohi have mentioned. Is here to improve the lives and livelihoods of adolescent girls and young women in various aspects, improving their reproductive and health services, improving, trying to mitigate gender-based violence issues, such as early marriages, sexual violences, physical violences, and other transnational harmful practices that we inflict in our girls. That actually we know that we are signatories to these international protocols. My friend and humble friend here will tell me, you have been a signatory to these international protocols. You cannot give your back to them. SWEDD has come to help us follow these protocols, make sure that we become full members of these protocols, and then we effectively implement them. On behalf of the project coordinator, on behalf of the PCU, on behalf of the PIC chairpersons, and on behalf of the entire project implementing committee, the sub-component membership, we are happy to have you here. We believe at the end of this 2 days exercise, we would go home having in mind that E&S and the GVB has taxed themselves to do things that actually they have done, within the year, from the beginning of the year right down to where we are. Their implementation is not a one-off. It's not a one-off. It's an annual basis as we speak. Let us just ensure that we take these 2 days activity seriously. We try to make sure we work together, because without you people, we cannot make headway. Without you people, we cannot achieve as far as the E&S components are concerned of this project. And as remember, I said World Bank projects are not fully implemented, if the E&S aspects are not fully implemented, because they are very, very important things, because they want to come and help the Gambia, but they don't also want to create problems for the Gambia, and that's why they want to look into the E&S aspects. The whole idea about SWEDD, it is thought about by the French, West African, so sub-Saharan African countries. They said they have a problem of high fertility rates. They presented the bank. They went to the bank and they were crying. Not crying like physically. They said they had a problem. They said they have a problem of high fertility rates. They have a problem of sexual and gender-based violence rampant in their countries. French sub-Saharan African countries. Girls are beaten. Girls are being raped. Girls are dropping out of school for one reason or the other. Either the parents cannot afford for them to proceed when they enroll, or they cannot even start at all because of whatever they may have to be doing at home. They said even if they are sent home, they're still having a problem of, ensuring that they empower them economically, financially. They also said some of the girls that are going to school, they have a problem of ensuring their dignity kits are provided for them. So when they presented this, somebody among the World Bank people, personnel who were listening, come from Anglophone sub-Saharan Africa. They said, we're having the same problem. We're having the same problem. But then they said, it's the French who are presenting their case. The French sub-Saharan African countries who are presenting their case. Where are the Anglophone sub-Saharan African countries? Eventually, we realize what is happening in Togo, what is happening in Cote d'Ivoire, Guinea-Conakry, and Mali. It's the same thing that's happening in Gambia. Because we are all sub-Saharan African countries. Mr. Fari will tell you, whatever is happening in Gambia is happening in Guinea-Conakry. But they said the Gambia and other Anglophone countries are not presenting their case. So that is why we took it upon ourselves as a Gambia. We went and presented our case. We said we're having the same problems. High fertility rates, early marriage, sexual gender-based violence, physical violence, teenage pregnancies, FGM, children dropping out of school when they enroll. So they don't even have the means of continuing. And those schools where the girls are going to school, when they're experiencing their menstrual periods, they stay home. Why? Because they don't have the means to take care of themselves while they are going through their menses. It's happening. Education reported this some times back. So that is why they engage government and other partners to see how best we make sure whilst they are going through their menses, how do we make sure they continue going to school for the 5 days or for the 6 days, depending on the individual, so that they don't miss their contact hours. Because for every single day that you miss, you're missing a contact hour, and that's going to affect your results at the end of the day. So they also said some girls are going to school, but they travel long distances. And according to the education policy, they said no child has to travel or should travel more than 5 kilometers to get to school. That's terrible. Imagine if you ask a Jola woman to walk 5 kilometers to get to school, that person will not attend school regularly. In one way or the other, the person will drop out. Yes. So you see, these are problems that are happening. So I'm just trying to give you the genesis why SWEDD is coming to intervene. And that's going to lead us to the project development objective. It's a multi-sectoral project, like Rofi has said. Multi-sectoral meaning it is not a single sector project. It's not owned by one ministry. It's owned by different ministries and agencies. Why? Because I have mentioned about the issue around ensuring girls start school and continue school up to secondary level. That is one objective that the SWEDD has come to address. Ensuring girls, when they start school, they proceed up to secondary level at least. And there is no other ministry that should be responsible other than the Ministry of Basic and Secondary Education. And that makes them as one sector who is part of this project. I don't know whether they are here. Mopsy, do we have them here? They are invited. I'm sorry they didn't come.
Have they invited?
Huh?
Yes.
They are invited?
Yes, they are.
Yeah, yes, I'm sorry they are invited. They are very key. So MOPSI is one sector that is also implementing the SWEDD project. Why? Because I have mentioned SWEDD has come to ensure that girls, when they start school, continue up to secondary level. And what do? We provide them with school materials, books, uniforms, learning materials. Even if necessary, we buy them bicycles so that they'll travel to school without any delay or challenges. The other aspect of this project is their reproductive health aspect. You know, girls, they get sexually mature very early. So while they are going to school, they get these issues around their menses, it has a lot of things that have to go with it. You know, they need their dignity kits, they need to be taken care of. So while they are going through their menses, they need some hygiene that they need to observe so that they will be able to upkeep themselves. And along the line, when they are sick, they need to go to school. They need to go to the hospital or to the facility to seek for care. When they go to the facility, what do we expect? We expect them to be given the services they have gone to seek for. If you are sick for a minor illness, you go to the facility, you are attended to by a qualified individual. And that is why the SWEDD is here to make sure that those materials, equipments that are required at the facility are also provided at the facility. But not only that, even in terms of the qualified personnel. Now, many times you say he was sick, he went to the facility, he only found a nurse attendant. The guy he found there is not trained. We complain about that. But here the SWEDD is here to make sure that we contribute in terms of making sure that the numbers of health workers, are increased, but not only by numbers, but they are even trained as well. Our MNCA program will tell you that we are working with them to ensure that we send many nurses to the health training institutions so that we have them, many of them trained to become qualified personnel or individuals or workers to ensure that once they are at their stations, whoever comes there to seek for care, it is readily available. Contraceptives are available, and other delivery kits are also available. So when you talk about the health service delivery, we know that there is no other ministry or sector responsible other than the Ministry of Health. So that makes Ministry of Health as another member of the implementing agencies or entity of the SWEDD project, because we have mentioned two now, health. Number 3, I have mentioned about GVB issues, gender-based violence issues, sexual violence, physical violence, emotional violence, all the violence that happens to girls are all violences that actually we know they are prevailing in society. Every day we see them. It's either we report them or we don't report them. Every day we see them. They happen in school, they happen in homes, they happen in societies, they happen across everywhere you may imagine. So the SWEDD has come to ensure that we address this, even if we cannot eradicate it, but we address to a level where it's no longer a societal problem. Early marriage, FGM, trade pregnancies, you understand, all the GVB issues. So we know that there is no sector responsible for these GVB issues apart from the Ministry of Gender, Children and Social Welfare, including their partners. So that makes Ministry of Gender, Children and Social Welfare as another implementing entity of the SWEDD project. But also important is, when you talk about health, you cannot talk about health in the absence of nutrition. Mr. Diba will tell me, Maki, you have forgotten something very important. Yes, nutrition comes into play. And that is why NANA, being very pivotal, being the lead institution about nutrition in this country, are also important IPs of this SWEDD project, because they will contribute towards ensuring that whatever has to do with the nutritional aspect that these adolescent girls and young women require is rightfully ensured at any given time that they require them. So NANA is part of the project. Now, youth empowerment. The SWEDD has come to look into youth empowerment. How do we empower them? Here, we're talking about two aspects: the economic aspect and the career guidance aspect. Now, when it comes to the career guidance aspect, here we talk about what? Creating safe spaces wherein you gather the young people. You go there, you bring them, the likes of Mr. Barry, you bring them forward and tell them, what do they want in terms of, building their careers on. You get the right mentors, you get the right facilitators, those of them who have expertise in that, you come and coach them. Depending on what they want to do, you give them the right guidance so that tomorrow they will become independent individuals to be able to man their own lives and livelihoods. And there again, we're talking about the Ministry of Youth and Sports, who will be responsible for this. And that is why they are also members of this important project. Ministry of Youth and Sports is also important in this project, and they are also implementing activities under this project as far as the safe spaces, the career guidance, youth empowerment activities are concerned. So the economic aspect, also we go back to the Ministry of Gender, because we provide them with small grants. The SWEDD has come to provide them with small grants. it looks like the WEF that they have been implementing before, but this one is kind of complementing the WEF, right?
Yeah.
Fadamfa,
yes.
the main woman. So they now give them grants, but a criteria has to be met. It's like you come in your CAFOs, you registered CAFO, the criteria that are set aside, you meet them, they give you the amount of money that you have applied for, depending if you have met the requirement. They give it to you, you go and implement whatever economic activity that you want to. You know, whether it's tie and dye, if it is tailoring, if it is sewing, Fadamfa will tell you number of activities that women, are embarking on. But the important thing here is, for you to note is, SWEDD has come to provide small grants to registered entities, groups, societies, to give them money to go and embark on economic activities so that they will improve their lives and livelihoods. Remember, sub-Saharan countries, they explain about this. We told them, look, you're having this problem, we are also having this problem. Not even realizing that Gambia here, we started this before. But the SWEDD has come to complement that. Okay? Now, in any country, how do we gauge them? We gauge them through their economic growth and economic development. And that, you're talking about the demographic dividends, the profiles, and all that stuff. How do we know that the Gambia has developed? It's true, and looking at the economic growth. Now, not in terms of the structures, no. The structures are just one. But the livelihood of the individuals, have the livelihood of the individual have changed. You can see it from the people. If it has changed, you will know. If it doesn't have changed, you know. So now, the National Population Commission Secretariat, they are normally the responsible entities in every country that will be looking at demographic dividend issues, economic growth issues. They work with every sector of life. They work with agriculture, they work with education, they work with health. Every sector in life, as far as is geared towards the development of that country, they work with you to ensure that the country moves from point A to point B. Right. So that makes them important implementing partners in this SWEDD project. PCU, we are just custodian. It's like Carrefour Lebamuldrong. Young Carrefour, Alamuda, and give it to them. We are keeping the Koro and then we are giving it to them. Fast. Yes. Right? So that is it about the SWEDD project. Remember, World Bank is entirely sponsoring the SWEDD project. If you ask who is giving the finances for the SWEDD, make no mistake, it's the World Bank. But the World Bank also doesn't have the only answer in terms of how. You can have the money, but you might not have the entire expertise in how to do about things. So that's why we have other development partners. Civil society are coming into play, development partners like the UNFPA, development partners like the WAHO Extrafinal Organization, the World Health Organization, and every other UN agency, including locally civil societies, locally NGOs, whoever is important as far as whatever we are doing is concerned, you are, please call on board to come and assist. All right. So it's targeting adolescent girls and young women. It's important that I mention that the project is not tied to one section of the country. It's a project that has come to be implemented across the country, across all the 8 LGS. Like I mentioned, education, Ministry of Basic and Education, Secondary Education. What are we doing here? We provide uniforms, supplies, dignity kits, and school girls. We provide what? Bicycles. Have you seen it? Then we give them what? You give them safe spaces. Right? If you go to the health service delivery over there, under the Ministry of Health, these are the areas that we intervene in. Supply chains, the contraceptives are provided. You look at them. GBV issues and pathway survivors, all these things are strengthened. Capacities are built, the structures are strengthened, the facilities are also put in place to make sure that the services are really available. Income generating activities, I have mentioned that. We provide them with small grants. Those that have met the requirements, you come, you apply, then there is a committee, Fadamfa will tell you there is a committee that's already set through the manual that has been designed, developed. If you meet the criteria, you tick the boxes, and then eventually you are given the money that you have applied for, then you go and, but then there is accountability after that, right?
Yes.
Okay. And then also when it comes to the demographic dividend, all those capacities that are required, We know that you cannot implement a project if you don't have the frameworks, if you don't have the policy guidelines, if you don't have the legal documents. So all these things are here. Because remember, when it comes to GVB issues, Mr. Fati will tell you, the Children's Act, the Women's Act, Sexual Offense Act, all these things are here to make sure that they guide us in making sure that we battle these traditional harmful practices. But then, if they are old and they need to be updated, SWEDD has come to support that. And I will tell you that in the 2025 work plan, I have a lot of activities in there, Mr. Fati, that has to do with reviewing the Children's Act, the Sexual Offense Act, the Women's Act. All of them are captured inside. That is implementing the project. And you think you have a policy document or policy guideline that is outdated, that is not meeting the current realities, and it needs to be reviewed, please bring it forward. Because we have to make sure that whatever we do is based on principle and guidelines. It's dictated by policy from bottom up. SWEDD is not here to do anything that is extraordinary or different from what government is doing. No. We are not just going to buy into what government has taxed itself, what you have taxed yourself to do. So if you feel you cannot go implement A, B, and C because policy A or framework A or strategic plan has expired, come forward. Tell us, we want to implement this particular aspect, but the policy document that is guiding us is outdated. We need to renew it. Of course, we are going to put it on board. But then we are not saying you bring it last minute and we know it has to be in the work plan. Because as you know, whatever is being implemented, it has to be in the work plan. If it's not in the work plan, then you cannot expect it to be implemented. This is the implementing committee. These are the committees that will look into the monthly activities of the project. Every month, this committee will sit and find out what NANA has implemented, what Ministry of Gender has implemented, what Education has implemented, Youth and Sport, NPC, everybody, what you have implemented, they will sit over it. I will present them. In fact, I will collect everything from you, put it together and present. When I present and I open my eyes, I listen. They discuss whatever has been implemented, what they have said they have implemented. What have been the challenges? What have been the successes? What do they need to recommend? So they meet every month. Then the next is the steering committee. This steering committee is the highest body, is the senior body to this peak. This is at the level of the permanent secretaries. Every implementing entity here, Ministry of Education, their permanent secretary is there. Ministry of Gender, their permanent secretary is there. Ministry of Health, their permanent secretary is part of it. Population Commission, your permanent secretary OVP is part of this committee, including development partners. So every 3 months, I have to call these people and tell them, for the last 3 months, this is what they have done. Whatever is not clear, it has to be clear there. These are all accountability measures, implementation arrangements. Okay? Implementing partners, that's you people. What we expect from you people is sending your contribution for the work plan, sending your monthly project brief. Because normally, before I call for this big meeting, I would have asked for this. Every month, I collect everything that is done in the month from all of you. Put it together and then call these people, come. They said this is what they have done. You will discuss what you have done. If it is done properly or not, then you will explain. What challenges you have, it will be explained. So that's what I expect from you people. The financial and development partners, the financial aspect probably is the World Bank here. Of course, they said the project is 25 million. I should have mentioned that. The project is a $25 million project. They've given us 25 million to implement for 5 years. All right? So the money is already there, available, as long as it's within the work plan that we have, that we are now working on. Technical support. We call the UNFPA, we call the civil society, both locally and internationally. We call the other development partners like WAHU. Please come and help us in doing A, B, and C. Ministry of Gender, when they are doing their child protection activities, we expect them to fall back to CPA coordinator and his membership to ensure that whatever technical expertise they need, it is provided. NANA will, for example, if they are doing their nutrition activities, they will bring their internal capacity or external capacity where required, like any other implementing agency. So this is the implementing arrangement. Just to tell you that the project, like any other project, is just coming, money is here, implemented. all these people are accounted for. Like I said, every month I have to collect what is being done. When I collect, then I call these people, they come and discuss. After this 3 months, I call these people. In fact, before I call these people, World Bank is here. Before I even call them, World Bank is already here. Come, tell them, let them come and tell us what they have done. So if I need problem, I have to explain. If you have problem, you have to explain. All right? So these days have gone past. You don't think that you need these days anymore. Maybe after this year, by next year we'll update this flight. You know, this was just there because of the beginning. It's a $25 million project. We did a negotiation in Senegal last year, in 2023, on the 16th of August. This is, negotiation means, bank is saying we are going to give you a project. Go and do preparation A, B, and C. Do all the preparations. When you do them, you come and now present to us whether you have done what we have asked you to do. Then we negotiate. If it is rightfully done, then they tick the box for you. Go ahead. If you have not done it right, they say go back and do it again. We went to Senegal in Dakar. We presented the bank. They tick the box for us in 16th of August to say, Gambia, you are good to go. You have fulfilled all the requirements. Go ahead. As the first English sub-Saharan African country to implement the SWEDD project. So we got the approval on the 29th of September in Washington. So when the Dakar people were satisfied, 29th September, we got the letter from Washington to say that Gambia, we are happy with you. Please, we are going to give you the money to start implementing. So once you get that from the development partner like World Bank, then immediately stop what they call preparation, you start implementation. So immediately we had to run around, myself and my boy Jaula. We run around to get activities because there we cannot say we are in preparation because we already got approval. We have to run around and tell them, give us what you want to do from October to December. We cannot waste time. So we had sleepless nights to run after people to give us what you want to do for the last 3 months of 2023. Then we got that. October we started, and then the first quarter also started. So here we are now, effectively 2024, from January 1st, we started implementing proper. Of course, there are challenges that are beyond us, that are beyond you. I mean, it has to do with a close collaboration. We have to work together and see how best we can address them, because some of them it has to be internal problems. As far as we are concerned, we've got the major procurements done. Procurements in terms of what equipments are needed. Bicycles, motorbicycles, laptops, tablets, you understand? Anything that actually you will need to implement the project, most of it has been bought so far from last year to this year, and distribution have started effectively. So you can see this was the day, this was the former TTL, Sam Mills, when he came to inaugurate finally the procurement material that was done, laptops, you know, whatever. You can see the Minister of Health at that time, at the time of the inauguration, that's Dr. Samate and the Permanent Secretary, you know. So the vehicles were also, you can see the vehicles, these are the vehicles, and somebody will tell you, when the projects come, you are buying expensive vehicles. Most of the money is going to the expensive vehicles, you know. So that is the project. I'll just conclude by saying, we cannot succeed without your involvement. Remember, I am not implementing, and all my colleagues at PCU are not implementing. We are just keeping the money and monitoring how the money is being implemented, period. You are the one implementing. So when we ask for you to submit your activities, please bring them on time. When we ask you to send us your monthly activity reports, send it to us on time. Quarterly ones, send it to us, because at the end of the day, if you don't send them, it means you have not done anything. So we need you guys to collaborate effectively so that the objective for us to achieve, as far as the SWEDD is concerned, is achieved at the end of the 5 years. Because the project is expiring at 31st of December 2028. So we still have a long way to go. And periodically, we are going to be evaluated. So I'll conclude by saying, let's continue collaborating. There is no one individual who can do it all. In order for us to succeed, all of us have to be part of it. You can see the journalists are here. Madam Jiba, people are here because we rely on you guys, not so? Yeah. To disseminate the messages appropriately. So it's like, it's a multi-sectoral, everybody's hands are needed on board. or on deck?
Saho, like I earlier introduced myself, I work with the Directorate of Health Promotion and Education as a Health Communications Officer, but also I'm part of the team for the Environment and Social Safeguard. So I will be taking you through a report summary of the activities that we have done as a subcomponent, that's the Environment and Social Safeguard component. I'm doing this presentation on behalf of the Environment and Social Safeguard focal person, that's Madam Rohinjai, and we'll be looking at the second quarter and the third quarter of the report. So as part of the SWEDD project, like Mbake was saying, all World Bank projects now need to have an environment and social safeguard component as far as the project is concerned. So the reason for this is because in every project that we might take part in, there is always issues related to environment and issues related to the society. So environment and social safeguard, what it does for us is like when we say when an individual has a bodyguard, what does he do? The bodyguard guards the individual. So this is what E&S does for a project. E&S is like a seal for the project with regards to any environmental or social issue that might emanate. But again, looking at the SWEDD project, the way it is structured, like Mbake was saying, we do not have a lot of environment issues because most of the things that they are engaging has to do with social issues. But notwithstanding, environmental issues might come up one way or the other. But whether they come up at any point, it is the E&S that is responsible for taking care of those things. So this is the reason why we have the E&S, and this is why it is very important as far as the SWEDD project is concerned. So over the past year, we have been doing a lot of activities as far as the E&S is concerned, and those are some of the things I'll be sharing with you. So the SWEDD project implementation committee and the coordination, that's the PCU, have designated an environmental social safeguard focal point. And the focal person responsible for that is Madam Rohinjai, who I work with, and plus other members of our team from the Directorate of Health Promotion and other stakeholders as well, in making sure that we implement all the activities as far as the E&S is concerned. So the responsibility is making sure they coordinate grievance mechanism, labor management procedures, and stakeholder engagements in alignment with the stakeholder engagement plan. So like the grievance management here is one of the biggest components as far as the SWEDD project is concerned, because most of the things we receive with regards to safeguard issues are related to grievances. Grievances on how it is implemented at local level, grievances from other stakeholders, grievances from all other implementing partners. So these are most of the time the things that we receive as far as the E&S is concerned. But notwithstanding, we are also looking at environmental issues and also stakeholder engagement. So we start with the second quarter of the project. So in the second quarter, one of the activities we did was orientation on E&S instruments, because it is important that E&S, we all understand, it might be a long-standing issue with regard in projects, but as far as Gambian projects are concerned, most of the time not very much importance is given to it, and this is the reason why it's becoming it's like a must when it comes to World Bank projects now, because they realize the importance of having some of these things in our projects. Let's take an example of social issues that we might find with regards to most of these projects that we implement in our community. There are vulnerable groups when it comes to our communities. Let's say we have children, we have people with disabilities, we have women. These are people that are vulnerable, and most of the time when projects come into our communities, these people are sidelined because they do not have the power to make decisions as far as the project is concerned. These are things that we need to address as far as the project is concerned. Another thing is when projects comes, they come with individuals being giving, let's say, grants, individuals being giving money. And sometimes the way these things are done in such a way that because you are my family or because you are my friend, the issue of nepotism plays a role when it comes to things like this. And all of these things need to be addressed by the ENS. So all of these things are things our implementing partners need to understand, not just from the central level or from the implementing body at the top level, but even at the local level, even at the community level. They need to understand that these are issues that come up as far as projects are concerned, and these are things we want to eliminate at the end of the day. So that is why it was important that we do an orientation of all our stakeholders on every ENS instrument that we have. So we familiarize ourselves with the ENS frameworks, such as the environmental and social management framework, the labor management procedures, the stakeholder engagement plan, the environmental and social mitigation plan. These are all documents, and these are all procedures that we made sure that we share with all implementing partners to ensure that they familiarize themselves as far as the ENS is concerned. And another thing is we do a quarterly joint monitoring. And this team conducted quarterly reviews of GM structures and service providers across all regions. So how do we do this quarterly joint monitoring? Because we have GM structures in all communities in the Gambia. How we have this is because when the NAFA project was taking place, they made up a committee that they call a grievance committee. So what this committee does for that NAFA project is that anybody that has a grievance, as far as that particular project is concerned, these are the people you come to and give them your grievance and tell them that these are the things that we have as far as the project is concerned and we are not happy with. So now that committee is responsible to make sure that they see a way of addressing that grievance, whether it's at their level or they are going to send it to another level, but this is basically the work they do, and that is the committee. So like like Rohi was saying from the beginning of the presentation, SWEDD is not here to reinvent the wheel, but we are here to make sure we strengthen the already available structures that we have. So what we did is we went to those structures, those grievance structures that we have in those communities, tried to engage them and let them know that there is a new project that is coming up, and that is the SWEDD project. So what they are going to be doing for the SWEDD project is the same thing that they have been doing for the NANA project, but it's a different project. But the idea is that we do not want to change to have different grievance committees. At the end of the day, that will just bring confusion in those communities. So this is what we did, and at the end of the day, we will be doing a joint monitoring. The reason we call it joint is because not only the ENS focal point is part of this, sometimes the GBV focal point joins us, also other stakeholders join us, Ministry of other ministries join us in these activities to make sure that we go to these communities and talk to these GM committees. The reason we are doing this is to evaluate, is to do a monitoring and evaluation to understand how far they are going as far as the project is concerned, as far as issues related to SWEDD is concerned. What are some of their challenges and how do they expect that those challenges will be addressed? This will help us make informed decisions at the top level. So this is the reason for that. And another thing we do as well is health, safety and environment social safeguard training, because we all understand you cannot bring up trainings to you cannot bring up project to people and tell them that this is what we want to do. At the end of the day, you need to train them and let them understand exactly what are their roles and their responsibilities. So this is another thing that we have done as far as our capacity building is concerned. So some of the stakeholders that we worked with through some of these programs that we did are first the government and the national bodies. That's the Ministry of Health, the Directorate of Health Promotion, NANA. They are a very, very key partner because they have really helped with a lot of the documents that we have. The National Social Protection Secretariat, the Directorate of Gender, MOPSI, the National Population Secretariat, just to name a few, because it's a PowerPoint presentation, please. But basically, these are some of the stakeholders that we have been working with as far as the activities we are implementing are concerned. So the civil society and community organizations, those are the CSOs as well. We have been working with the PF Initiative, the NGBV, the Girls Pride, CHE, CPA, Regional Health Promotion Officers. They are here with us. All of these are CSOs and other partners that we have been working with. You realize that most of the organizations we made mention of are either related to women, children, or gender issues. That is because the whole focus of SWEDD is women and adolescent girls empowerment. So that is why most of the initiatives they do is shifted or focused towards those target groups. So we also work with collaborative networks, representatives from CSOs and other entities across the regions to ensure a comprehensive approach in addressing E&S concerns. We all understand when it comes to social issues, most of the time, probably environmental issues, these are issues an entity can look at and say, okay, we'll be able to take care of it. But when it comes to social issues, we seriously need every other individual, every other partner that we are able to get to be able to handle them, because social issues are complex. And we'll understand as I go through my presentation, you understand some of the social issues that we'll be facing with regards to the project, because the project talks about the issue of FGMC. The project talks about the issue of early marriage. The project talks about the issue of women, abuse of women. The project talks about the issue of abuse of children. And we all understand these are topics, anytime they are mentioned, especially in communities, it always brings up a lot of arguments and a lot of opinions and a lot of beliefs at the end of the day. And these are social issues that we need to address. But how do we address this? We cannot do it alone, like let's say a particular department or a particular, you cannot do it alone. You have to engage every other department as far as they are concerned to be able to bring them together, so that at the end of the day, if you approach it as a team, that way everybody's input will one way or the other bring something into the team, and we will be able to solve some of the social issues. If not, if you want to approach it as an individual entity, it's always difficult to be able to handle it. Looking at our progressive update, we did an orientation on the SWEDD instruments, introduced the stakeholders to the SWEDD objectives and priority areas, our focus areas as well. We did quarterly joint monitoring, like I said, of the GM structures, and also we did a training. So the key activities implemented are the development of the SBCC materials, because we all understand for behavioral change always you need to have a targeted message. You need to develop messages, you know. Okay, let's say first you need to have a research, a study of your area, why the area that you are talking, and you need to know your audience as well. When you know your audience, you need to be able to come up with messages. So when you develop these messages, you need to, you know, involve stakeholders, obviously, like I said from the beginning. We review these messages, develop them, review them, and make sure that they reach to their intended audiences, because for social and behavioral change is an ongoing thing, and messages are very important as far as behavioral change is concerned. So that is why it is one of the key activities that we implemented, and those were included flip charts, facilitators manuals, and also participants handouts. So we also did stakeholder sensitization on GBV, SEA, and SH, that's gender-based violence, sexual exploitation and assault, and sexual harassment. We conducted outreach to raise awareness on gender-based violence, sexual exploitation. We also did a national dialogue on GBV with leaders. We engaged National Assembly members and religious leaders to promote advocacy on GBV prevention. These are issues that are happening, and it is mandatory upon us, as far as you pledge to work with this project, that you would make sure that you advocate for these things to ensure that they end. And this is what the project is doing, and this is what the ENS is doing. Some of the achievements we have along the way in the second quarter was validation of the ENS instrument. That's the essential documents that we have. The code of conduct, the GBV manual were completed and distributed. I don't know if you are not if you have not directly signed the code of conduct, know that your supervisor have directly signed the code of conduct, because this is a requirement of the project. Any individual who does not sign the code of conduct cannot be part of the project, because everything that the code of conduct is trying to say is a guiding tool that is trying to let us understand what we are supposed to do and what we are not supposed to do as far as the SWEDD project is concerned. So this tells us about sexual harassment as far as the project is concerned, sexual exploitation, use people's images, how to interact with your co-workers, what to do when there are grievances. These are all detailed information that are found in the code of conduct, and it's a guiding tool that tells us exactly what we're supposed to do or what we are not supposed to do. So it was required that we go around the country with that code of conduct. After orienting individuals on the SWEDD project, then that code of conduct is passed around to everybody to ensure that you sign, you read it and understand it, then sign it to say, okay, I have accepted to be part of this SWEDD project. If you have not signed it as an individual, then your institution, the head of your institution, signs it. And if he signs it, then it becomes binding upon everyone that works in that institution as far as you are going for a SWEDD project activity. So this is what the Code of Conduct does. And we also have all other activity. The GBV manual is also a very good material, and I hope we read it. So the GBV manual and all other documents are there, and they are available. When you need them, you can always contact Rohi or any other person, and they will be made available to you. We also did a nationwide orientation. Was a success. Oh no, we went across all the regions. Our health promotion officers were here. They did a very wonderful job in those regions, mobilizing their people, and we did those orientations. We also enhanced the stakeholder capacity by training them and making them understand some of the materials we are using, and also overall the SWEDD project. So let's look at the challenges we have faced over that second quarter of the year. Yes, we have done a lot of activities, but again, we have really been faced with some challenges as far as the SWEDD project is concerned. And one of those is limited trained personnel. Like during our visits to the GBV areas, that GBV service providers, what we did was, it was more like a little research that we did. So what we did was try to understand in every facility how many people are trained on GBV, how to handle the cases. When GBV cases come, how do you go about it? So we realized that from that little survey, from all those facilities we have gone to, a lot of the individuals that are there are not trained. Or even if they are trained, the training was not sufficient, because they could not explain to you exactly what GBV is, or how, you know, they would be able to. They were honest enough to tell us their level of knowledge with regards to issues related to GBV. So that was a very big issue as far as GBV is concerned, because to be able to respond to cases related to GBV, you should have knowledge about it, because it's a very sensitive case. At first in the Gambia, let's say some 5 years, 10 years back, 10-15 years back, issues related to gender-based violence or things like that might be taken a little bit lightly. But now I can tell you for free that when you say rape, even to a layperson in the community, they don't take it lightly, because they know the consequences behind it. Our SBCC is, whether we know it or not, it's creating impact, because people are getting aware of some of these things, and people are getting to respect and understand that these are serious issues and we need to take care of them. So that shows that we are going somewhere. But again, if we are going somewhere, we need to also have a service that we are going to be provided. Our service provider cannot have low knowledge when we are sensitizing people on reporting GBV cases. That will not tally at the end of the day. So that is one of the challenges we have. And another thing is the need for GM committees training. During our orientation as well, we understand that the GM committees were, yes, they were trained by NANA, but it was more like a one-day orientation. So some of them do not really get to understand what are their roles and responsibilities, because for them, some of them thought, okay, they are responsible for even distributing the money that comes when NANA comes, distributing the money, or even deciding who should receive the money and who should not receive the money. I hope we are familiar with the NAFA project, because I'm trying to reference to that. So that was the issue. So we thought, okay, maybe a little more training will make them understand that as GM committees, that is not your responsibility, but your responsibility is to ensure that if people have grievances in the project, they come to you and you help them out in their grievances. So another thing is under-reporting and delay reporting of GBV cases. This is also an issue we have, a challenge we've seen. People are not reporting cases, and this is mostly prevalent in the rural Gambia. Because we've gone to a community, I cannot remember, I think it was in CRR. The health workers, we had a meeting with the health workers in the hospital. What they were telling us was that the issue of war battering was predominant in that area. Like, they will not go more than a week or so that a woman will not come with several injuries on their bodies. And at the end of the day, when you ask them, Muneketa, the reply they give you, Mboitale, or they give you another excuse, because they are afraid to tell you this is what happened. So that under-reporting have been happening there. Another report we got from there was the issue of teenage pregnancy as well. They did complain that the issue of teenage pregnancy is rampant in that community. Like, girls were just getting pregnant. You know, so all of these things are, at the end of the day, we are not mostly reported to the police. It just stops at the health facility, because what the health personnel can also do is advise you, but they cannot force you and carry your hand and say, "Bita police led by force." That is not their work. They can only orient you to let you know, okay, this is what is happening, you need to report the case or whatever, but they cannot force you to go and report the case. And most of those cases are not being reported. And unless cases are reported, it becomes difficult for us to be able to know the extent of the problem. Because they always say, we say gender-based violence, talk about women. And somebody said, are men reporting? And we said, no. Do you have data for men? No. That is why. But basically, this is another challenge that we see. And another thing is reluctance to involve law enforcement. Like I said, all in all, a lot have been done. A lot needs to be done. And there are a lot of recommendations that are coming from everything that we are saying. And this is the essence of having a stakeholder engagement. Because at the end of the day, you as a single stakeholder don't know everything with regards to a particular topic. You will need the expertise of other stakeholders. And this is why we are here. And at the end of the day, we hope that we can go home with tangible recommendations that at the end of the day, let's say our next year implementation, those are things we will look at and we will try to put them into action. So some of the recommendations we came up with from the issues we had was enhanced training for the GM committees. We also want to strengthen the multi-sectoral coordination because we know how important it is, and also increase stakeholder involvement as far as the project is concerned. So some of the lessons we learned is stakeholder appreciation, that is participants highly value the training and expressing commitment to E&S standards and demonstrating their willingness to support the SWEDD activities. Also, we fostered collaboration. The training sessions created a more cohesive network among government agencies, CSOs. Like myself, I am here, but I'm not very long in the ministry. But at least I have known a lot of people from a lot of agencies and other ministries. And that is mainly thanks to some of these projects, especially the SWEDD projects that we are doing. So that has enhanced my capacity to be able to, involve them in things that I am doing. And if I don't understand one or two things, I can, let's say, call somebody from Nana because I want to develop some messages and I do not understand where to go. So this is the essence of having these stakeholders as far as these projects are concerned. And these are some of the things we've learned. And also commitment to continue supporting the SWEDD project. So all in all, all our implementations for the second quarter were successful, though we had some setbacks, and that is inevitable. But again, recommendations were given and lessons were learned as far as those setbacks are concerned. So we can also quickly look at the third quarter, then probably we can come back and do some discussions before I would finally close, because it's almost going to 2. So for the overview of the third quarter, all our third quarter activities were implemented as per the 2024 annual work plan budget, and also stakeholders that were involved, like the second quarter were the CSOs, the NGOs, and other stakeholders. So this one is a bit smaller. I don't know. It will be hard to us to recognize. But the first one is we had a 5-day national capacity building training on grievance management and prevention of sexual exploitation and abuse, sexual harassment and gender-based violence, facilitated by the UNFPA regional technical assistants. He was saying something very important. That is, sometimes even those of us that are working with regards to these rape issues do not fully understand some of these things. And I don't know for others, but personally, I realized that during this training that we had, because it was a TOT, and we had some individuals from Senegal, some technical assistants, but you realize that yes, I do have an idea of what I'm doing, but there are a lot of lapses with regards to our knowledge to some of these things. And that is why always trying to bring yourself up to speed and up to date is very important. And this is not just about the project issue, but as an individual, anywhere you work, it's always important you try to update yourself with information, with what you are working with your tools. Because at the end of the day, those are the tools you want to use to be able to engage people. And in health communications, we always say, if I do not understand the message, I do not expect to make anybody understand the message. It's as simple as this. If I do not understand what I am saying, I do not expect to make anybody understand what I am saying. We also did a TOT, that is training of trainers, because when we are trained at national levels, you become a national trainer. So what you do, you also go down to the regional level and do a TOT of those regional representatives, so that the regional sentence, we will also go and do a training of the community members. Because at the end of the day, from the beginning of the SWEDD, what we told these communities is that SWEDD project came in looking at a bottom-top approach. Because we have realized that most of our projects have failed because Rohi from the national office wants to control what is happening in Sare Debo, which is not possible. No, this is the fact. This is the fact. You at the national level want to be involved in every single thing that happens as far as the project is concerned, be the local level, be the regional level, and this is not sustainable and it does not really make sense, because at the end of the day they have people that they are that you could be able to train that will have easily disseminated any message that you wanted as far as the project is concerned. And this is why when it comes to the SWEDD project, most of the activities that I am involved in, that I know about, we always use the bottom-top approach. We make sure that you engage these communities, it's not about going to teach them to do something. No, you need to engage them to be able to take ownership of these projects. When it comes for, let's say, social and behavioral change, is that being achieved? We need to ask ourselves some of these things. And how do we do that? The only way we do that is make sure people take ownership of things that we give to them, because that's the only way it becomes sustainable. So we did some TOTs. Also, some of the achievements we have, that's the enhanced knowledge from the TOTs and the national training. Also, we had strength in network, like I said. We also have increased capacity, because from the national training, we were able to invite a lot of stakeholders that all of them were involved in the SWEDD project now, and we could always reach out to them. So some of the challenges we had was, at the beginning of the trainings, there were controversial debates and discussions as to the section proceeds, but participants gained knowledge, especially during the national TOT. So we also have an incident investigation report for a fatal incident that involves one of our SWEDD vehicles, First Aid. So the recommendations we have is to expand training, reach untrained community grievance management committees across all regions, because when it comes to grievances, handling them is not an easy thing, but it's always easier for grievances to be handled at community level. But I always say this when I'm presenting, when it is handleable at that particular level. Because somebody has said, issues of rape, do not even try handling it at community level. We make that clear with these community grievance committees. You can always handle issues of marriage disputes, sibling disputes. These are, little disputes that happen between community members. That is why we have the grievance committees in those communities. You can always call them, because the grievance committee consists of influential people in the community: the imam, the alcalo, the VDC chairman, the women leader, a youth leader. So these are people that can be able to form a committee, call these people and talk to them, try to make sure they mediate between themselves, instead of every time going to the police. These are some of the things we advocate, but we let them understand that there are cases that you cannot handle at your level. So when you have them, please always make sure you report them to the right authorities. So this is just to say, for us to be able to achieve some of the things we want to achieve in these communities, we also need to be making sure that we give them those incentives to boost their morale, because it's a tedious work at some point. They all have responsibilities, so it's important that we bring up these incentives to ensure that it's just a boost, is boosting their morale. Make sure you make that clear to them. We cannot pay them, but it's just a way of telling them thank you for the services that you are doing for us. So the national TOT, also the cascade training and the national TOT. For the national TOT, training of trainers on case management, it's important that we do that, and the training of health service providers across the country, and also cascade training of project vehicle drivers. It's important we also involve our drivers. Let's not forget them. They are part of the project, and they need to understand these are the people traveling with us day in, day out as far as the project is concerned. And it will be funny if they should involve in anything that violates the project and they are going with us each and every day, so it's important that we always put them in the picture as far as projects are concerned. So in conclusion, the third quarter training session also fostered collaboration and equipped communities with the skills to manage grievances and respond to. And these efforts are essential to building safer communities and supporting survivors with the necessary resources. So this is all I have for you. Thank you very much. Yes.
My name is Emily Juf, and I am the Program and Partnership Support Officer for TOSTAN, based here in the Gambia.
Good. Now, Madam Emily, tell us about today's stakeholder engagement what have you learned today as far as the SWEDD Plus is concerned, as far as your institution, TOSTAN, is also concerned?
So it's really quite a pleasure to be able to participate in the stakeholder engagement now that we're wrapping up this year, 2024 of programming. We've learned a little bit more about the progress, the activities that other partners and agencies have been working on. And also it reiterates the commitment to have the SWEDD Plus be a multi-sectoral and very inclusive program through not only its design, but bringing partners like CSOs around the table to reflect on what has happened in 2024 and discuss the priorities and recommendations for the coming year. And for TOSTAN, we very much look forward to continued partnership with the Ministry of Health and the Ministry of Gender, who are the core leading institutions, together with other ministries like Youth and Sports. We have NANA as well. It's really quite a unique program design, and we're very pleased to participate today, and also to know that this commitment of ensuring that we have this bottom-up approach which centers communities is maintained throughout the program lifeline. So TOSTAN has over 2 decades of experience here in the Gambia, and our community empowerment program really centers communities, their well-beings, African education, and we have had incredible impact which is measurable around gains for women and girls' rights specifically. And so it's really quite exciting to be part of a program that is aligned in our values, and ensures that conversation, policy, program, and work centers women and girls' rights, and continues this long-term work that is necessary in terms of policy, advocacy, but also at community level. At TOSTAN, communities are at the heart of all change that we do. In terms of partnering with stakeholders, that is again very much a core value at TOSTAN. I am a partnership officer because everything we do, we believe we must do together, and to be able to add value, but also learn and share our approach, our methodology, and learn from our partners. So really it's a pleasure to be here. And perhaps the last thing I would say is that as we move forward in the SWEDD, and as we continue to think about social behavioral change, we should ensure that we keep the dialogue, the focus, the learning on communities, because they are the leaders of change itself, and we have seen the incredible transformation that they're able to make happen within their communities and as it ripples throughout the nation.
My name is Abdullah Silla. I work with the National Populations Secretariat under the Office of the Vice President as HR Economic. Today's stakeholder involvement was very good and productive. We learned so many things, and at least it combined all the IPs and the implemented partners that are working on the SWEDD project. And I am here to represent national populations. At least we discuss about the challenges and provide recommendations that we know that, like, by next year, inshallah, we will continue to do as we are expected to do. My recommendation will be to encourage all the stakeholders, all the institutions that are working on this SWEDD project to tie our belts, at least to work harder towards the successful of this project. Because if this project is successful, it means Gambia is successful, and the Gambia is the only Anglophone country under this SWEDD project, and we are hoping higher, inshallah.
We're talking about the subcomponent 1.5, which is the prevention and response to GBV, SEASH. As Barke mentioned in the morning, regarding different components and also the different subcomponents under the SWEDD. So I'll be talking about the activities that was conducted in the first, second, and third quarter. We started this year, though we started last year. In last year we had activities with the adolescents, because for the SWEDD we all know that we are targeting the adolescents, especially the girls and also the women. So this one, we'll talk about the first quarter. The first quarter, the planned activity was, we developed a comprehensive training PowerPoint and also materials for GBV SCA. I know people will say, why should we have that training to just prepare PowerPoint, which each and every one of us can do that. But we just wanted to have a comprehensive PowerPoint when it comes to gender-based violence, SCA and SH. So this brought us for 3 days involving different stakeholders. 15 stakeholders came together from the Ministry of Health, from the Ministry of Gender, Ministry of Education, Ministry of Youth and Sport. We have the CSOs and also the NGOs. We came together for 3 days to develop materials. So that material that was developed, wherever we are going, when it comes to training and advocacy, we extract things from that manual and present it in different activities that we did throughout the year. So regarding this activity, it was conducted in February, so the first quarter in February. It was to develop a comprehensive PowerPoint, as mentioned, material for GBV requirement procedures and sanction regime to facilitate upcoming activities as just mentioned. So the material development, which was a practical undertaking involving the production of the material, then we evaluate the material. From evaluation, we have to adapt it. We adapt it and then we exploit it. During the exploitation, that's during the activities we conducted based on awareness as well as the training we conducted in the length and breadth of the Gambia. So in this development, we had methodologies, we conducted research, we divided the groups into 3. Since it was 15, we divided into 3, and each group, we are tasked on what to do. Group A, the research on the GBV aspect, and Group B, SCA, this is sexual exploitation and abuse, and also Group 3, sexual harassment. So this is how we divided it, and from there we had plenary. They presented, and then later on we adapted it, and that was later sent to PCU for acceptance. Later, from the acceptance, we started the exploitation, and we did awareness as well as training. So during this activity, as mentioned, there are challenges as well as achievement. We've achieved a lot, and the achievement number 1 was bringing different stakeholders to come on board. It's not only Ministry of Health, or it's not only government, but we have the CSOs that work with us. And the CSOs and NGO that we targeted, we only focus on those who are working on the sexual reproductive health, especially on gender-based violence. We have the Think Young Women, the Girls Agenda, the Girls Pride, from Banjul to Brikama. So they sent their representative, and it was gender balance. We didn't only focus on women to come, because in the letter we specified that it should be gender balance. So that's what we did. We achieved that, and also a comprehensive manual was developed at the end of the 3 days. Participants, they were fruitfully, they engaged in the discussion and shared their experiences as well, because CSA might not do the same as CSOB, but we came together and they shared their experiences and also the activities that they normally do. So development of the training manual was a collaborative effort with input from various stakeholders, ensuring the comprehensive and inclusive approach. So the development manual included key topics, as I mentioned, and also the methodology as well. Methodology, what methods are we going to use, and what procedures are we going to use when it comes to those methodology. And case studies as well was brought up to be incorporated in whatever activity that we'll be doing, or whatever presentation that we'll be doing. Case studies when it comes to GBV, case studies when it comes to sexual exploitation, and case studies when it comes to sexual harassment as well. So it brought a platform for networking as well when it comes to engaging different stakeholders. Networking, we met together, so that like now you can see when we had this activity, some people even migrated, left where they were, and now joined another CSO because what they were doing impacted different people. So when it comes to achievement, as I mentioned, these are just few achievements, but also there must be challenges when it comes to facility. Now, right now here we have challenges when it comes to internet. So the first challenge that was observed during our activity was internet, because doing research, you need internet facilities as well. So one was limited internet access Participants face challenges with limited internet access, hindering their ability to conduct research and access to online resources during the workshop, because we wanted to just adopt and adapt. We adopt from other countries and also adapt also from other countries when it comes to research, and then transform it to suit the Gambian context as well. So the other aspect was time constraint. Because when it comes to stakeholder engagement, when it comes to research, when it comes to developing material, 2-3 days was insufficient. So they complained that it wasn't enough, but that was the day, the duration given to do this activity. So the 3 days duration of the workshop was perceived as insufficient by some participants, and limiting the depth of discussion and the time available for practical exercise and group work, because they were in a rush as well, because from 9 to 4 is not even enough to conduct a research, talk less of 3 days. But after the challenges and also the achievement that was achieved, there have been some recommendations as well when it comes to the activity. We have recommendation and needs. First one is a need to tailor approaches for different target groups as well. So like example, when we are developing materials, we can say, okay, this is a stakeholder engagement, but do we have any disability here? Do we have the police here? No. So we need to also consider, when we are doing stakeholder activities, we need to also involve the disabled people as well as the police officers, because when it comes to GBV, the morning section we mentioned about the security personnel, they are very, very important. So they recommended that we include those people whenever we are having such an activity. The aspect inclusion of practical case studies and scenarios, because it was limited though, but they said that we have to add more. These are recommendations from different participants during the activity. Incorporating survivor center and trauma-informed approaches as well. That's the one-stop center. That's, I believe that now it is going on, because based on our recommendation, we're able to work with Ministry of Gender to increase more of the one-stop centers identified. The importance of creating safe spaces for survivors of GBV. So you can see, if you can remember, I mentioned I invited Ministry of Youth and Sports. In the SWEDD activity now, Ministry of Youth and Sport, they have created at least safe spaces. We have about 14 identified safe spaces from Banjul to Basse. So you can see that based on our recommendation, we're able to communicate with Ministry of Youth and Sport to see what they can do regarding the safe spaces. So when we come to lesson learned as well in the first quarter, the lesson learned overall, the 3 days consultation workshop organized by the SWEDD for the development of the manual. It was a significant step towards strengthening efforts to address GBV issues in the Gambia. So the collaborative effort of participants from diverse background and organizations underscored the importance of working together to combat GBV and empower vulnerable people. So when it comes to different CSOs, they have contributed from different CSOs what they have been doing when it comes to gender-based violence, what they have been doing when it comes to sexual reproductive health. So you have the opinions from different CSOs. The first one is the Girls Agenda. They mentioned that they do conduct weekly meetings for adolescents to discuss various issues related to their well-being and safety. And the other one is WAVE. WAVE is not the WAVE money that we transfer, but there is an CSO called WAVE, and that it means Women Association for Victims Empowerment. They are at around Manjai N. That's where they are. So what they normally do, their activities, they organize women support groups in Region 1, holding monthly meetings to empower and support women in the community. We also have CPA, that's the Child Protection Alliance. What they mentioned was they have, they manage voice clubs in schools to educate children on child protection components and raise awareness about their rights and safety. Rights. In the other aspect is the NSGA, Nova Scotia Gambia Association. They implement peer health programs. So most of you know about NGA, their activities, health programs in schools and communities to address gender-related health issues and create safe space for students. We also have NGBV. They provide case management services for women and adolescents experiencing GBV, along with offering 3-month shelter for those in need. And you also have the Think Young Women, that is the TYW. Think Young Women, their activities, they run mentorship programs on SRH, sexual reproductive health, and life skills to educate adolescents on reproductive health issues, life skills, and also promote safe spaces, safe practices. You have the WIL, Women in Liberation, Women in Leadership and Law. They operate in the Fonyi region and Region 1, working together, working towards empowering women and creating safe space for them to thrive and lead a various capacity. You have also Gas Pride. Gas Pride is represented here. They produce reusable sanitary pads to schools and communities and conduct capacity building on the production of reusable sanitary pads. So these are some of the CSOs, their contribution. So you can see the different types of CSOs that are here during our activities in the regions. I don't go alone. I involve the CSOs to be part of the team. So these are some of the things that we conducted, we did in our first quarter, bringing the stakeholders together, working towards making a comprehensive PowerPoint presentation for GBV, SCA, SH for the GBV component, this is subcomponent 1.5. So this was just one of the activities that's in the first quarter. So the development of the manual. Before conducting a training, we need to create awareness. We went to make awareness, and the activity was like to conduct awareness raising, outreach campaigns, to publicize the GBV. People know about GBV, we need to go more and meet them, meet different actors or workers that are running GBV, the teachers, the community members, the youth, the health workers, the security personnel. So we went to all the regions, from Basse to Banjul, all the 6 regions, wherein we communicated with the health promotion officers or the population officers to identify people and to create a one-day advocacy regarding GBV. So the activity aimed to raise awareness on these important issues and discuss ways to prevent, to stop or minimize GBV, especially on child marriage. This is the harmful traditional practices. And the harmful traditional practices is child marriage and female genital mutilation, so that they can know more. But we have a lot of engagement, we have a lot of achievement, we have a lot of recommendations as well, and also some challenges. So part of our achievement was we met also the governors. Most of in all the regions, all the governors, because we did it, the awareness was done at in the governor's office. There are halls in different governor's offices, and therefore we invited and make sure that all governors were represented. You can see that one in green is the governor in LRL. She was there, but I believe now she has been moved. So she witnessed this activity, and the participants gathered for the activity were about 240 participants. We have from different stakeholders, various sectors, including the police, health workers, the youth members, the gender and child protection unit, social workers, the youth groups, education officers, media personnel, community members, directors from health and education, and governors actively participated in the program, despite it was just a one-day advocacy from Basse to Banjul. That's Region 6 to Region 1. But when it comes to this, I mentioned that we can achieve something without mentioning the challenges. There are limitations as well. So during the section, participants pointed out different challenges. And this includes, number one, this includes the high cost of responding to GBV cases, especially shelter, when the need arises. Some girls are victims, and we mentioned in the morning about the rape, but some also victims of incest, sexual harassment. So when they go to report, maybe to the gender officer or the population officer, most of them don't have shelters. So they always refer back to their homes. So if they refer back to our homes, it's also another problem. So they mentioned about challenges is, once reported, where will they be sheltered? So these are one of the challenges. The other aspect is lack of access to legal representation for victims. pressure from authorities, families, and even reporters for police to withdraw cases or bail culprits, lack of practical support for survivors, and participants also noted the difficulty in enforcing laws that protect women and girls and the challenge of sustaining project initiative after the funding ends. So because people are asking even, how about what's the way forward? One, is this 5 years project? How about what's the way forward? At the end of the project, what are they going to do? Some women mention what are they going to do at the end after informing the police, after exposing themselves. Now, what are they going to do once the families are taken? What are they going to do? How are they going to support them? So these are the things that some of them mentioned that they don't go and report because of these challenges. And the recommendation given was participants, they made several important recommendations during the meetings, inclusion of persons with disability in awareness campaign. It was a gap. During the awareness, we totally forgot about the disabled people. And as I mentioned at the my first deliberation, they are always sidelined. We always say that, okay, they are difficult to reach. But after all, I believe that they are not difficult to reach, but they are unreached. We don't reach them. You know, and most of the time, the disabled people, they are the most vulnerable, especially when it comes to the deaf and dumb, when it comes to the, no, I want to call the word blind, yes, visual impaired, you understand? So they are always sidelined, and we need to really engage them as well. This is part of the recommendation. Also establish centers in the regions to enable service providers respond to cases appropriately and provide timely support to survivors. You can see that why they mentioned this, if a victim go and report at the health facility later on, you know how a one-stop center they are here, you know, once a victim go and report, they always refer the victim to the police. You know, it delays. So if you refer the victim to a police, the victim might not even come back because they need a police to witness the case. And the police wasn't there. So I believe that they have to take care and support the victim first before referring the victim to the police. You can see that these are some of the challenges that really happen. Consider safe and secure mobility options that could carry more people at a time for schools instead of bicycles. So why this one came up is the SWEDD project is they're supporting adults and girls from far hard-to-reach area, providing bicycles for them. So most of them believe that giving them or provide those bicycles doesn't make sense. They rather use another mobility, either provide a bus rather than a bicycle. Because whilst riding the bicycle on their way, they can be attacked. You know, you need to see how our places are, they can be attacked. So they prefer, most of them, they prefer that the MOPSI should change the strategy. Instead of providing bicycles, they need to provide at least a school bus. Though there are school buses here, but when it comes to the rural area, you can't find the school buses there. So this is one of the, this is another recommendation. Providing legal representatives for victims and initiating measures to stop harmful practices like FGM. We know that from the referral protocol, in each region, you have a legal representative. But you can see that in all the regions, the same legal representative in Basse is the same for CRR, is the same for LRR, is the same for Northbank. So yes, there's a legal protocol here, the referral protocol. If a case is in Basse and you have to call that person and the person is in LRR, you see, it's not static anyway. It's not something that is very, very advising. You can see in every facility also, you have a doctor there, a medical doctor who is there. You have the nurse, you have the social worker, but the challenge is the legal practitioner. It's only one who is overseeing all the facilities. So these are recommendations from the participants themselves in all the regions. So we have lesson learned as well. Participants also suggested practical support for vocational training instead of only providing knowledge. You give them the knowledge. At the end, they sit on the knowledge. But including them, building their capacity more, training them will really help them. Transfer the knowledge to them. Now, what can I do as a victim? As a victim now, I was raped and I'm no more going to school. What can I do? We have to maybe skills, we support them in skills, training. I believe that gender, you're doing it now. Subcomponent 1.4, exactly. So also creating programs for girls that have never been to schools. including the multidisciplinary facilitation team in training for effective community engagement. That's why, from this recommendation, the work plan, that is next year, I have targeted only out of school going girls to train them regarding GBV. You understand? So, because nobody is doing it. Out of school, we always ignore them. We're just training those who are in school. But you have a lot of out of school adolescents that needs also to be trained as well. So, marital rape, I know it's a problem in the Gambia. Most men don't want to hear that marital rape because they say, as far as it's my wife, I have to do what I'm supposed to do. So marital rape should be addressed through counseling. That's what they said. And they can address it rather than going to the police to explain that my husband rapes me. Yes, wait, my husband raped me. Rape is rape, you understand? Because like sometimes you can see that women, based on people who came for counseling as a health worker, most women, like every month, there must be a time wherein you should not have access to your husband. You should not have contact, sexual contact. But some women, they spoke, whilst in their period, some of their husbands, they forced them. Forcefully. Yes, yes. Some of them don't know. But once it is explained, they understand now. You understand? So even someone came and spoke to me personally that, yes, we know that most of these gender-based violence cases, most of the contributing factors is either the religion, the culture, or the social norms. Understand? The religion say no during Ramadan, but one woman said during Ramadan, while she's cooking, the husband asks her, meet me in the bedroom, I need you. You see, yes, these are things that women spoke. You understand? Of course now, I said Ramadan, what did I say? Yet, the husband said that it's her own property. So, this is a marital rape, because she said that one is rape then. But when I explain, they understand that it's a rape. You understand? There are times that, okay, they're not in the mood, but they will still even rape them. But also, I'm so gender balanced, because when it comes to that also, men also mentioned, it was a very nice discussion when I went to the provinces. Men also said that, even if I don't say, I'm not in the mood, the woman will come and harass me and say, I want. So it's also marital rape. So it's both marital rape.
Advocating for women's health, their fundamental rights, when we don't talk about the issue of their reproductive right. And this is something that I know, yes, this is where we go back to the drawing board with Tostan. How do we ensure that community understand this and draw this balance, the power dynamics? Otherwise, it's something. But men still feel like they still own them.
It's their property. Yeah. So you can see that this is what's really happening.
As we are talking about victims of rape, do we look at the causes of rape? That's what I want to do as advocates. Do we look at that one also? What causes the rape to take place?
Yeah, most of the time, sometimes, because you can see that different age cohort are raped. Yes. Different category of people are raped. An infant is rape, and Ibadu is rape. You understand? Some people, they say because the cause is because of the sexual outcome, like the dress code. You understand? Some of them, they say because of the dress code. But you can see that it's not the dress code that causes. You cannot justify that it's dress code. We have to make them understand. You have your choice of dressing. I have my choice of dressing. Why are they raping niqabs? Why? So you can see that some will say because of the dress code. No, it's not the dress code. Some they will say, oh, she has mental health. No, he won't see a man and go and rape that person. No. So you can see these things are also addressed as well. And rape comes in different forms. Rape comes in different ways. There was a girl I always talk about. A girl was going hijab, returning home from school. 16-year-old girl, hijab. You understand? But no, environment also is a factor. I always advise the young people, environment is a factor. Know your environment. The girl took a taxi wherein three men were there, including the driver, from Brikama going back home to Jambanjeri. You understand? And their way, you know the Nyambai forest there. On their way home, the driver stopped. The driver stopped, and then the three men and the driver came out and raped the child. And then tie her hands. That's where she spent the night. Up till today, the child is psychologically traumatized. You can see, it's not because of her dress code. You understand? Some people, it's just attitude. why they do it. Not lack of self-discipline as well.
But I know for certain research will tell you, some people psychologically, they're sick. Because who could rape a baby? A normal person will not do that. Right? The pedophile level, even look at the pedophiles and all this stuff, you realize that they have some mental, psychological issues surrounding that. But again, also, what do we do in order to help? Because for me, when you talk about of human rights, it's about how do I look at both parties? How do I respect the fundamental rights? But sometimes too, they are. But I think this is where also it's important when the project talks about social safeguarding. Right? Because for me, it's what environment do you create? Because most of the time it's about accessibility. That's why most of the time when you look at these guys that are raped, is how do you close this person with this younger. In many cases they would say what? Grooming. You get used to and you penetrate. So it's about how do we look at that environment where these things occur, but equally how do we see that this person is it quite okay? Because I cannot rape a 6-month baby.
Yeah, you know, sometimes habit becomes nature. It's part of that individual. It's part of that individual as a young boy growing. You start doing it, and you believe that it's part of life. You keep on doing it. Some people, you think they are not psychologically okay. Some people have been rejected, and they want to be raped. Once they are caught, you know, they will go to prison. They don't have food to eat. When they go to prison, you will eat. Some boys are,
Go to
prison, and it's because some don't have poverty, feeding.
They give counseling to them too.
Yes, they do counseling to them. You understand? That's why I say sometimes habit becomes nature, and they need thorough counseling and support. That's why they mentioned that we have to also to keep on creating awareness, doing advocacy. You know, when it comes to sex and sexuality, it's hard to talk about, but the approach also matter on how you start talking about it. You understand? So regarding the lesson learned regarding marital rape, should be addressed through counseling and advocacy instead of reporting. Instead of reporting, instead of addressing the root causes of GBV, such as poverty and lack of education, and orienting the income governors to understand the projects better. So these are lessons learned when it comes to quarter 2. So for quarter 3, it was now the training. We went to all the regions again, 2 days training for each region. When it comes to the religious leaders or also National Assembly members, the Population Commission, they are dealing with it. They are training a lot of religious leaders. They are becoming aware about it. What we are in aware, they are now becoming aware. And now we advise them that during their summons, they can be talking about it. We engage them. You know, Friday Hurbas, they talk about the things that are really happening when it comes to GBV in society. And we can see that most of them are doing it. Every Friday, I always receive voices of imams during their Hurbas. They send it. I have them here. Also in the churches, and also pastors are also talking about these things. You understand? So that's how they have been engaged by the National Population Commission Secretariat. They are really doing advocacy, and that's number one activity. Advocacy involves the religious leaders and also parliamentarians. You understand? Yeah. So we had a training. We had training all project actors or workers to enhance capacity for continuing GBV SCASH mitigation, prevention, and response. Because we believe that once you train people, once you build their capacity, once they know about different forms of GBV, not only one form was tackled, but the 5 forms were also tackled when it comes to the training. We have the 5 forms, which is the physical violence, the sexual violence, economic violence, psychological violence, as well as the harmful traditional practices as well. So we tackle all of these, and it really helped them. Most of them, they didn't know, because they believe that gender-based violence is only physical, by slapping, beating, or even, you know, shouting. They didn't know that economic is also part of it. They didn't know that even sexual is also part of it. So that's why we had 2 days training all of them so that they can understand GBV and SCA. So you can see the activity, the aim of the activity was to enhance the service providers. And when we say service providers, it's not only limited to health workers. You have the education officers, they are service providers. You have the police officers, they are also service providers. You have the community workers, they are also service providers. So they are serving the population. That's why we didn't even stop only to train the health workers, but we trained the nurses, the public health officers, police officers, social welfare officers, gender officers, community development, and education officers. We build their capacity on GBV. Once their capacity have been built, now when GBV comes to their decks, how will they mitigate it? How will they respond to it? You understand? So that's why we aim to conduct this, explain to them, so that once they are back to their facilities or wherever they are working, they're able to respond to GBV. So that's what we did in all the regions, and we captured about 415 service providers. Had 415 service providers. In URL, we had 80 participants. CRL, Jama is here. He was very, very supportive. In CRL, we went, not only, we have to just divide it, you know, CRL is 2. We went to Wasu as well as in Bansang. We have, like, it was an emotional thing somehow, because some of the participants, they came out and testify about what really happens to them. Especially one woman mentioned that she is a victim of all the forms of GBV that we have mentioned. Yes, she is all, because the first one, which is the physical violence, it was her own mother who violated her whilst she was grade 11, removed her from school because of poverty, connection with someone who is in Europe to come and marry her without her knowing even that person. So her mother seriously, physically violated her. And when the man came, you know, when he came, she refused to go, but the mother forced her to go. Psychologically, she was traumatized. Now to go and meet now the man. The man also forced her in bed, that is sexually, because he said, I already paid the dowry. Whether you know me or not, I am already your legal husband. So she was forcefully, sexually and physically violated as well from the man. And now she's no more going to school. She's now experiencing economic violence because she doesn't have anything. You understand? And the last one, of course, she's a victim of type 3 FGM. You can see the woman, she was even crying during explaining whilst the discussion is going on. Training them, engaging them, supporting them to make the regional sanitary part will really help them, as mentioned when we were in URL.